Are you feeling sick to your stomach long after recovering from COVID? You're not alone. Join me as we discuss the often overlooked symptoms of nausea in long COVID and what you can do about it. Hello, and welcome to this growing community of people who are ready to heal from the weird mystery symptoms that conventional medicine doesn't have answers for. I'm Carrie Bailey, your functional nutritionist. I work with people with anxiety, depression, and other weird mystery symptoms. And together we use food, lifestyle, and supplements to heal. Nausea can be very difficult to describe. You might feel like, oh, I just feel sick. I feel sick to my stomach. I feel ooky. When my kids were little, I said they have a ooky tummy. You could feel it you could possibly feel it in your chest, you can feel it in your stomach, and you can even feel it in the back of your throat. You might be experiencing some other symptoms, not just nausea, right? You could maybe throwing up or maybe not, right? You could have changes in your appetite, have a loss of hunger. You might feel fatigue, headache. You might feel dehydrated, like dry, like almost like you want to do a dry heave. You might feel acid reflux or SIBO because it is a stomach issue. So when you are feeling these things and having these experiences, it's important to ask a lot of questions. And so when I work with my clients, I always ask a lot of questions to try to figure out what's at the root cause of this nausea. And clearly it came in long COVID, but there could be more going on. So I want to know, are you throwing up? Are you not throwing up? Is the nausea constant? Or is it intermittent? If it's intermittent, what brings it on? Are there any other symptoms you're noticing at the same time? Bloating, abdominal pain? Does this nausea have a smell or some other sensation? How intense is this nausea? And important to understand, like, again, what else is going on in your health world? Are you taking medications? Because a lot of times people might be taking a medication and not realizing that one of the side effects of that medication is a symptom they're feeling. Some other symptoms you might be feeling along with the nausea is vertigo or dizziness. Headaches can come along with it. Definitely migraines are associated with nausea. Obviously, if it's not long COVID that triggered it, if there's any food poisoning or stomach flu at play, that could be a contributing factor. And it kind of gets confusing if, at the same time you got the stomach flu or food poisoning at the same time you have COVID or recovering from COVID. If you're a woman, it's important to understand, of course, are you pregnant, right? Let's make sure that you're not pregnant in this case, right? And so probably the first thing you're going to go to the doctor and you're going to tell them you're nauseous. They're going to ask you, are you pregnant? Could you possibly be pregnant? Whether you're menstruating or you're in perimenopause or menopause, it's important to, again, understand where you are. If you're cycling, where are you in your cycle? Because what I've noticed in working with hundreds of clients is that women who experience their symptoms might get worse or come up even during the first part of their cycle. So on the day 1 through 5, for instance, when you're having your period, your immune system is suppressed. And so you might be more likely to have symptoms then. You might also be likely to have symptoms on the middle of your cycle when you're ovulating. Because again, your immune system is suppressed because that's how we make babies, right? You don't want your immune system attacking the baby as it's being formed. The last thing that can be a contributing factor or trigger is vagal stimulation, right? And you might be doing this inadvertently. So you can stimulate the vagus nerve from either gargling water, singing, humming, different sensations that you might feel that are stimulating the vagus nerve. Let's get into what's causing this post-COVID nausea. We know that viruses are at play with long COVID, right? And that what's happening is your central nervous system is being attacked by these viruses. The vagus nerve is the most important nerve when it comes to stomach issues. You always want to look at the vagus nerve. And this vagus nerve can become irritated or inflamed, right? And this vagus nerve, I've talked about in previous videos, it runs from your head. It's the longest nerve from cranial nerve. And so it runs from your head to your tailbone and it branches off to your organs. If this vagus nerve is inflamed anywhere between your stomach, your abdomen, and your head, anywhere along the way, it can create that sensation of nausea. So you're probably thinking, okay, Carrie, what's causing this inflammation? And so there's a few answers to that, right? You can have in your stomach, there are 2 bacteria that are at play, possibly. They could be possibly at play. One is H. pylori, and the other is Streptococcus. H. pylori is the bacterial infection that leads to ulcers or stomach cancer. And streptococcus is just another bacteria that can live in your stomach. You probably heard of it as from strep throat. It can live in your throat. It can live in your sinuses. It can live in different parts of your body and cause symptoms. Some other causes of this inflammation could be viruses. So we know in long COVID that these resurrected viruses happen, right? So in some time in your life, if you had Epstein-Barr or if you had shingles or some other herpes related virus, that these can be triggered, right, to come up and be active. And one way that you can figure out if you have an infection at play attacking your nervous system is you can look at basic blood work that you would get from your doctor. One thing is called a CBC, or a complete blood count with differential. Now, the differential part's key because that's going to give you the breakdown of your white blood cells. So when we look at overall white blood cells, we want to see if your white blood cell count is high or low. We want it in the range of 5 to 8. And if it's too low, your immune system's suppressed. If it's too high, you've got an active infection. If it's too low, you could still have an active infection. It's just that you've had it for a really long time. The differential part comes in place when it looks at some of the specific types of white blood cells. So you've got your neutrophils, eosinophils, basophils, monocytes, and lymphocytes. And those 5 types do have different functions in your body, but they still need to be in the optimal range. In functional medicine, we have a different range than what your lab gives you or your doctor gives you. So we want to look at that range and see, are you high, like there's an active infection, or is it too low, like it's suppressed, like it might be an infection that's been going on for a really long time that your lymphocytes, for instance, can't keep up. And so it's important to have someone who knows what they're doing to look at your blood work to see if there could be something going on. There can also be issues in your liver, your stomach, or your pancreas, right? And something related to your digestive enzymes. So it's important to understand, right? When you know that sensation when you get nauseous and you want to throw up, that it's like a watery taste in your mouth. You just know it's coming. You know that nausea and that sensation is coming from the water in your mouth. That's like the digestive enzymes, right, that start in your mouth. The best way to see if this is an issue, to see if there's something going on with your liver or your stomach or your pancreas, is to look at another standard blood work you get from your doctor. And this is called a metabolic panel, and might be called a comprehensive metabolic panel. And we want to look at your liver function, also your stomach acid, your digestive enzymes, and see how they're doing. We can check your liver function by looking at your liver enzymes, which is your ALT and AST. And then we can check out your stomach acid to see if there's enough hydrochloric acid function to break down your food. Those markers are going to be called BUN, B-U-N, or protein, or albumin, or globulin. All 4 of those will tell you if your stomach acid is too low. I do have an interesting client case. And again, this might be something at play here. She had this issue many, many years ago. So it was definitely before COVID. It could have been viruses underlying that were at play here. So that's why I want to bring it up. So this particular client came to me and she said, Carrie, no matter what I eat, I throw up. I'm like, okay, let's uncover this. Let's put those pieces together. Let's solve this case. So she said every time she would eat, she would throw up. So we got into, like, we took out some foods, right? Then we got into figuring out that certain positions that she was in after she ate or during her eating time or after she ate would trigger her to throw up. So what we were able to isolate was that she likely had a hiatal hernia. So a hiatal hernia is when the stomach protrudes up through the diaphragm, right? So the stomach is a muscle and it's going to come up through there and it's going to cut it off. It bulges. And so it's going to, of course, infect the function of it. So that's why any food come in would want to come back out. So depending on what position she was in, it would activate that hiatal hernia. Your diaphragm is a muscle that lives kind of around the center of your torso. And its job is to help you when you're breathing, right? To push things down and pull things up. Like when you're breathing, your lungs, it lets your lungs expand and come back up. And so what happens is that inflammation must have happened somewhere along the way where the stomach came up through the diaphragm. Once we were able to figure that out, we were able to pull out very specific foods for her, gluten, dairy, and eggs, for instance, and other foods we'll talk about more in a little bit. Let's jump into some things that you can do for this nausea for yourself. One is to consider hydration, right? First of all, are you getting enough water? Are you hydrating enough? Are you drinking 8+ glasses of water? Is your pee clear? Okay, and it might be. And it just because that just happened, it doesn't mean that you're not dehydrated, because you need minerals. So you need the electrolytes. So you can have water without minerals and you still be dehydrated. And so it's important to have the hydration. Most people are chronically dehydrated. The first thing we want to do is make sure that you're hydrated. The system, what it reminds me of a little bit is the car battery system, right? Your battery has this little electrolyte solution, right? And when that solution goes out, boom, you don't have any more juice to run your electrical system and your battery dies. So we don't want that to happen to you. So we want to take that same concept. Your electrical system, your central nervous system, runs on hydration and minerals and electrolytes. So I like to bring in celery juice or cucumber juice or both, especially first thing in the morning, right? That's a really good time to bring those in to hydrate. You can also use coconut water to hydrate, so nature's natural electrolyte. And then the other things are raw fruits and vegetables, right? So there's more water content in your raw fruits and vegetables. And also, when you are cooking your vegetables, if you steam them, you're going to have more water content. And that's going to just help the whole hydration. Because remember, as you're eating those steamed vegetables, not only is there natural water content, you've got the minerals, you've got everything your body needs in order to assimilate it, to get those nutrients into the cell. All right, let's jump into what foods you want to avoid if you're nauseous. You want to avoid coffee, chocolate, soda, alcohol, dairy, and high-fat foods. If you need some help getting started on this healing journey, I definitely recommend my anxiety and depression recovery guide in the description and the comments below. There you're going to get recipes, tips, and tricks, and everything you need to get started on this healing journey. So you don't have to do it alone. So check it out. The next thing I want to get into is a special kind of food. It's not an herb. It's not a food necessarily. It's a root. And that is ginger root. Ginger root has a long history in really healing nausea. And there's a lot of ways to eat it. My favorite way is to take the raw root and to either peel it or grate it and put that in water. And you can always strain it. You don't even have to peel it, honestly. You can just grate it and put it in water. Let it steep for like 15 minutes. You can drink it warm. You can drink it hot. However you want to drink it. You can add lemon, you can add honey, make it however tastes yummy to you. And you can drink that throughout the day. So it's going to not only hydrate you, it's going to help with that nausea. Now, this one is a little bit more Band-Aid, not necessarily a quick fix, but at least it'll get you over the hump until you really start healing this nausea and healing your other symptoms of long COVID. And this is Tangerine essential oil. And you can buy this on Amazon. I'll put a link in the description below, but you can just take this essential oil and you can just smell it under your nose. You can put like a drop on your wrist and just sniff that throughout the day, but that will help you with that sensation of nausea. All right, let's recap. The nausea you are experiencing from long COVID is likely from the inflammation of your vagus nerve caused by some sort of pathogen underneath, some kind of virus or bacterial infection. What's most important first is to hydrate. You want to hydrate with green juices, raw fruits and vegetables, or steamed vegetables. You want to avoid any acidic foods and drinks. And drinking ginger or grated ginger infused water or ginger tea is really healing. You can also use tangerine essential oil to help calm down the nausea as you heal. So give me a thumbs up and consider subscribing to my channel so you can see more of the videos as I release them each week. Thank you so much for being here. I'll see you in the next video.